Hello and welcome to episode 35 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is, should you stretch it? Should you strengthen it? My hip flexors are tight. My hamstrings are always tight. But should I stretch it? Should I strengthen it? How do I know which one to do? Last episode 34, we discussed how to never get injured. That was a huge lesson. I am shamelessly plugging that myself, saying that if you have not listened to episode 34, you need to go listen to episode 34. It is a crucial understanding on how to do your very best at avoiding injuries with what you're currently doing or new activities that you plan on doing, and it can save you thousands of dollars, thousands of hours dealing with injuries. So go listen to that if you know what's good for you. Just kidding. Okay, not being that harsh, okay? But I highly recommend it. All right. But I'm a little biased. So anyway, this week's episode. Today's episode. Stretch it or strengthen it. I just made a post on my Instagram about how a tight muscle is often a weak muscle. Strengthen more, stretch less. And I received a few comments saying, well, how do we know? How do we know? I made an entire podcast on, does stretching make your situation worse? Is stretching a waste of time? Go listen to that. I don't know the episode number off the top of my head, but be sure to scroll through and listen to that for some more in-depth information on stretching itself. But today's focus is, how do we tell if we need to strengthen or stretchen it? Is our hamstrings tight or hip flexors tight because they're actually tight and they need to be stretched, or is that because of something else? So first off, it's important to recognize that the very, very, very simplistic idea that a tight muscle is short. It's like shortened. It's crammed together and shortened. That is not true. The idea that stretching a muscle is literally lengthening it is not true. You cannot change a muscle's permanent contractile length through, closing the muscle or lengthening. Like, of course, if a muscle is in a shortened position, all the contractile tissues are shortened in that position, right? Like flexing your bicep is flexing your bicep. It's shortening those tissues. Stretching your bicep is stretching the bicep. It's lengthening those tissues at that point. Okay? But someone's bicep does not just randomly seize up and get totally tight and they can't lengthen. They can't lengthen their arm because their bicep literally won't let them. Like they can only, open their arms to 90 degrees. That just doesn't happen, right? So if a muscle is tight, it's not literally because all those contractile tissues are shortened. Like a lot of people think, if you sit all day, your hip flexors are shortened. No, they don't. That's crazy. That would be crazy if the literal lengths of our muscles would change based on being in a prolonged position. That would be crazy. We would all be all kinds of jacked up. All right, that would be nuts. So it's important to recognize that. The only thing that would cause a tissue to permanently shorten or permanently lengthen would be some sort of pathological condition, okay, which 99.9% of us don't have. All right, so I'm talking to the majority here. I'm talking to those without pathological issues, pathological tissue disorders. We are healthy. We have healthy muscles, but they might feel tight. So many people are out there stretching their hip flexors, stretching their hamstrings, saying, I sit all day. My hip flexors are shortened, so I need to lengthen them. No. We already addressed that. Forget about that. Okay, well, my hip flexors are tight then. They feel tight. They feel tight. Feel. That's the word, feel. Things can feel a certain way, but they are not that in reality. You've heard about holding onto something so cold it feels hot. You say, oh my gosh, this is hot. No, it's not. It's really, really cold. It just feels hot. I feel this particular, type of way, right? That's a sensation. So something can feel, quote, tight, but not necessarily be tight. I want you to understand that, okay? Because multiple things can cause the feeling of tightness, not just a tight muscle, something that needs stretched, but many things can. And that's what I'm here to discuss today. So I'm going to make this really, really simple. I don't want to make it all complicated. Not that it really would be, but I've already talked 6 minutes about almost nothing, just setting up some context here. So now I'm going to get into the points I'm trying to make, okay? If you want to stretch, if you want to strengthen, but want to know when they're most applicable, there's a few steps that I would go through. And I'm going to discuss the most common areas, okay? Hip flexors and hamstrings. It's most common. It's most related to the low back rhetoric, right? The low back narrative, I should say. Tight hamstrings, tight hip flexors, weak hip flexors, low back problems. I've never fixed anyone's low back issues through addressing their hamstrings or hip flexors before. I don't believe I ever will. But they're commonly related to low back issues, so that's why we're going to discuss them. Point number 1. Okay? Point number 1. If you don't strengthen an area very often, it probably needs strengthened. Super simple, okay? So simple. How do we know if we should stretch it or strengthen it? Well, let's think about it. You're sitting all day, your hamstrings are tight, your hip flexors are tight. That's the way that you feel, right? Okay. John Doe, you're coming to me for low back pain. You feel like your hamstrings are tight and your hip flexors are tight, right? Yeah. Okay, John. Do you work out? Yeah, I do. Do you do hamstring exercises? Yeah, I do. Okay. Do you do hip flexor exercises? No, I don't. Okay, well then you should probably strengthen your hip flexors and stop stretching them since you aren't strengthening them. Problem solved. Okay. That's where I would start with that person. So if you're only strengthening an area, I guess either or, right? If you're only stretching an area and it feels tight still and it's not getting any better, then think, am I doing any strengthening exercises for this region? No? Okay, maybe I should. Right? Simple as that. Simple as that. Now, let's say you have been doing strengthening exercises for them. Yeah, I'm strengthening my hamstrings. I'm strengthening my hip flexors. Both still feel tight. They still feel tight. Okay, well, now let's assess, are they tight? Okay, let's do some range of motion movements, right? Let's do a lying straight leg raise for the hamstring, right? You lay flat on your back, you raise that hamstring as far as you can. The goal is typically 90 degrees, right? If you're close, then don't forget about it. If you're able to move to the extent that is required for your workouts, for your desire, then if you're at like 80 degrees, well, who cares? Okay. Don't make it a big deal. All right. You don't have to be perfect in all areas. All right. You can't be perfect in all areas. So, I mean, if that's not really affecting you, then who cares? But if you're at 50 degrees, right? Okay. Well, that's a little tight. Let's figure out why. That could be a situation where potentially progressively stretching it could improve the nervous system's tolerance to stretch. If you are strengthening it and it's still tight, and you can visually see that on a range of motion test, both passive and actively, meaning if you actively raise that leg up as far as you can, and then someone passively does that, they grab your leg and they raise it as high as they can, it goes the same distance, okay, then yeah, it's possible that stretching that situation could improve your nervous system's tolerance to stretch. And you might be able to improve that over time. But here's a test that I love that is going to blow a lot of the viewers, the listeners. It's going to blow your mind. Okay? Try this. Let's say you're someone who said, I've always had tight hamstrings and I have low back pain. I know it's because of my tight hamstrings, but no matter how much I stretch them, no matter how much I strengthen them, they don't get better. Try this. Listen up. Lay on your back. Do the straight leg raise test. Let's say you only get to 60 degrees. Observe your leg, mark it, have a very good visualization of how far it goes. Okay? Lower that leg back down. Now, with both of your arms. Put both of your arms along your side, to the side of your body. Push your arms into the floor. Drive your arms into the floor. You're going to feel your lats engage. You're going to feel your shoulders engage. You're going to feel your core engage. That's the most important thing here. You're going to feel your core engage if you push your arms into the floor. Now, immediately raise the leg again. See how far it goes. When you do that, did you notice it went further? Like significantly further? It won't be like 60 to 65 degrees. It'll be like 60 to 70 degrees or 60 to 80 degrees. Or more, I've seen at times. Did that happen? Well, then what that might mean is that your core function is not setting up your body's platform in a way to which it can handle these extra ranges of motion to where your body might feel comfortable allowing them to go these distances. Your body might be guarding and saying, hey, you know what? You're strong and you're doing these things and we appreciate that, but your core function is not ideal. Your breathing pattern is not ideal. So we don't feel super safe. So we're only going to let your hamstring go this far. And then the second you give it that stimulus, the second you engage that core and give it that proper stability and that function, it goes, oh, okay, we can do it now. And it lets your hamstring go another 20 degrees. Boom, there's your solution. You don't need to strengthen the hamstring. You don't need to stretch the hamstring. You need to work on your core function. And that doesn't mean doing six-pack ab workouts. Doesn't mean doing bicycles and crunches and leg raises all day. It means practicing your belly breathing, because for some individuals, just doing 2 minutes of concentrated belly breathing will produce the same result without even engaging the core. They can lay there and we can focus on expanding the belly, generating intra-abdominal pressure, really focus on breathing, and their hamstring flexibility, in quotes, will automatically change. That's a core function issue, not a hamstring tightness or stretch or strengthen issue. That is a core function issue, and this happens all the time. That could be your ticket, and that's going to tell you what to work on. Additionally, let's use an example for the hip flexor. There's a test called the Thomas test. That's when you lay on your back, you kind of scoot your butt close to the edge of a table or a bed or whatever. You grab one of your legs, the one that you're not testing, and you bring it up to your chest. So you're holding one knee to your chest. The other leg, you let it lay off the table. You want your butt to be close to the edge of the table so that your leg is free to fall down. If it does not pass 90 degrees, this test would say, oh, your hip flexor's tight, right? If it does pass 90 degrees, it'd say, okay, that's an appropriate range. You want it to go down. Some people would say, oh, well, if it goes past 90 degrees, that means it's not tight. But if it feels tight, then you should strengthen it. So that would be the same situation with the hamstring, with the straight leg raise. Let's say it feels tight, but you're able to go to 90 degrees or further. Well, it's obviously not tight, right? It's obviously not tight. You have fantastic range of motion. So strengthen it. So there's a little test to determine. Okay. But another way, once again, you could apply this to the hip flexor test or the hamstring test. Let's go back to the Thomas test though. Let's say you lower that leg, the one you're testing, and it doesn't pass 90 degrees. It's at 70 or something like that. You're like, yeah, see, I told you it's tight. It's tight. I need to stretch it really bad. Well, let's try this. Without stretching the hip flexor, without stretching it, we could just stand up. Stand up, put your foot, that same leg, put your foot through a kettlebell or any weight for that matter, or a band for that matter, and do 2 sets of 10, knee raises, I guess we would call it, hip flexor raises, whatever. Pull that knee straight up, not stretching it. You are not stretching the hip flexor. You are training the hip flexor. Maybe something you don't do that often. I've shown a few videos doing this on my back. You can lay flat on your back, go to a cable machine at the gym, hook your foot on the cable, and then just drive that leg straight up to 90 degrees or greater, training the hip flexor. So let's just say you do 2 sets of 10. Okay, now go redo the Thomas test. Now, does it go lower than 70 degrees? Does it hit that 90 or does it get even lower? Let's say it does. But did you stretch the hip flexor? No, you didn't. So what does that mean? That means it's probably a neurological inhibition due to poor control of that muscle, due to weakness, due to your body not really knowing how to, use that very well because you never train it. So there you go. You did not stretch it to make it go further. You strengthened it and it went further. So what should you do? You should probably continue strengthening exercises, right? So there are a few ways that you can see if other things are involved. So as I discussed with hamstrings, you can do a straight leg raise. If it goes really, really far, then you can be rest assured it's not tight, so I would strengthen it. If it goes a short distance and stretching it and strengthening it is making no difference, then try the core activation trick. Drive your arms into the floor. Do it again. If it goes further, then you need to work on core function. There's other individuals, especially, with my career as helping people with disc herniations, low back pain, and sciatica, many, many times this hamstring tightness will be from referral due to the disc, due to the nerve, and we need to address the nerve, address the disc, address the low back, and then their hamstring flexibility returns. That's very, very common. But in this particular podcast, I'm discussing healthy individuals, not ones with low back issues, not ones with nerve tension, not ones with disc referral. I am referring to healthy individuals without low back issues. So that's a way you can address the hamstring. The hip flexor, I discussed the Thomas test, where you can allow the leg to drop off. If it goes further than 90, it's obviously not tight, right? Just like the straight leg raise going past 90, obviously not tight. Go ahead and start strengthening it, see if that improves. If it goes short and you have not tried strengthening it, then go do a hip flexor exercise and retest. And if it goes further, then you should start a strengthening based program for that. You could also try the core trick too. If you do the Thomas test, you failed it, do a set of dead bugs. Do 2 sets of dead bugs, redo it, and see. Does it go further? Okay, there's another core function indication. So this is the best way to self-diagnose, to self-assess these sort of tight or weak situations with your body, with any muscles, but especially the hamstrings and the hip flexors, and how they might relate to supposed low back issues, how it might not be causing your low back issues at all. Usually they're not, but it's ways that you can begin addressing them within yourself so you can potentially figure out, what do I need to do? Should I keep stretching it? Should I start a strengthening program? Should I work on my core? If none of those are working and you have low back issues, then maybe you and I should talk so that we can figure out what the last thing is to get you back on track. But I hope that this sheds some light onto the strengthen or stretching topic. I know it's confusing for a lot of people. I know I talked through a few situations. Feel free to re-listen to this and really concentrate on the steps so that you can practice it within your own life and you can learn more about how to control your body, how to address your body, because that's what my job is. My job is to work with individuals one-on-one around the world and to teach them how to fix themselves so that you can get results effectively and you learn how to maintain those changes for life. If you learn something from this podcast, if you learn something, if you benefit from it in any way, please leave a 5-star rating and review. I would greatly appreciate it. It helps grow the podcast. And if you're watching on YouTube, please leave a like, comment, and subscribe and share with a friend. If you or someone you know are struggling with low back issues and are having a hard time finding the results that you deserve and you feel like you're just spinning your tires, not getting anywhere, let me help you. Submit an application using the link on my website or in the show notes on this or in the description on my YouTube channel. Also, if you do not follow me on Instagram at RehabFix, you should. You can find that application link in my bio as well. And I post a lot more videos to my story. And that is a great way to really see what I do and to see, if our priorities align with getting you back to the things that you want to do and getting you back to 100% quality of life. Finally, move more, move in nature and in the sun. Continue to spread goodness, encourage others, find ways to make people smile, find opportunities to input positivity into someone's day so that they are motivated to pursue their goals and to do the same for somebody else. Thank you so much for listening and have a great day.